Good afternoon, everyone. Thanks so much for joining us on Facebook Live. We have a quick message for our Facebook or Spanish viewers. Jose, if you want to take it away.
Yes, thank you. Of course, let me just... Gracias por acompañarnos en esta sesión informativa con la doctora Mase. Esta actualización se transmite en español en nuestro canal de YouTube. Para sintonizar la transmisión en español, oprime el enlace en nuestra página de Facebook con el condado de Sonoma. Gracias. Back to you.
Thank you. Appreciate that. So my name is Jennifer LaRocque. I'm here with the County of Sonoma, and this is our COVID-19 briefing for Thursday, the 18th of November. And we're live on Facebook in English and on Spanish in YouTube. And we're here today to share a brief update from Sonoma County's Health Officer, Dr. Sundari Mase, and then take questions from the media and community. So if you have any questions, you can leave them in our Facebook comments, or you can email us at publicaffairs@sonomacounty.org. With that, I can hand it over to Dr. Mase. Go ahead.
Great, Jennifer. Thank you so much. Can you hear me?
Yes, we can. Thank you.
Great. Thank you so much, everyone, for joining us today. Sonoma County remains in the purple tier within California's blueprint for a safer economy. Our rate of new daily cases per 100,000 is now 15. Our test positivity rate is still low at 4.3%. Our equity metric was not updated by the state this week. Since there was no forward movement, the California Department of Public Health did not use its health equity metric for this tier assignment for this week. Though the county's case for adjudication was strong by adding our uncounted tests to our denominator for our test positivity metrics, and we felt that that enabled us to qualify for the red tier, the timing was not good. With new daily cases and test positivity rates escalating rapidly throughout the state, California State has determined this week that all adjudication requests were unlikely to be approved. Due to the unprecedented surge in the rate of increase in COVID-19 cases, the California Department of Public Health has pulled the emergency brake per Governor Newsom. 28 counties that had moved into red tier status were placed back in the purple tier. This means that the spread of the virus in 41 of California's 57 counties is now considered to be widespread. For 94.1% of the state, business activities are highly restricted, and any schools that have not already reopened are not allowed to do so without a waiver or until a county has been in the red tier for 2 weeks. We've emphasized testing more broadly across all communities because it helps us find and isolate our cases quickly, lowers our test positivity rate, and gives us a downward adjustment on our case rate. This enables us to offer support to those who are sick so they don't infect others. And it allows us to reach people who have COVID-19 quickly. It also allows us to find people who are asymptomatic and get them isolated as well to decrease transmission of COVID-19. And additionally, all of this will drive down our metrics so we can qualify to safely open our schools and businesses. We want to thank you for answering our call to get a COVID-19 test. The response to our increased pop-up testing was so incredible that our hotline calls tripled in less than 2 weeks. We even surpassed our target goal of providing over 1,000 tests in a single day. As you can imagine, the phone lines were busy. In some cases, the hotline team was unable to answer calls or respond to voicemails promptly. We recognize that this is frustrating and thank you all for your patience. The county responded with immediate solutions to this issue, 2 of which are to double the hotline staff to help monitor calls and launch an online appointment calendar for residents to make their own appointments. Check it out for yourself. Go ahead and go to sonomacounty.fullslate.com. And one final note today. I really want you to consider the fact that COVID-19 doesn't take holidays off. Cases and positivity rates are spiking across the region, the state, and the nation. For the health of our whole community, please be careful to reduce opportunities for spread this season. We strongly recommend that you avoid travel, limit gatherings, and choose to celebrate with household members or remotely with friends and family. Thank you. We now have a few minutes for questions from the community and the media.
Thank you, Dr. Mase. And before we hand it over to questions, I was wondering if Adam from County Council could give a brief update on where what role the county plays with school waivers and where the state stands on school waivers for Sonoma County.
Yes, so we have 9 schools that have received approval to reopen. This week we submitted for referral to CDPH with a recommendation for approval Victory Christian Academy. We have already begun the consultation process, but that process may take a little bit longer as the state is concerned not only about the statewide surge in new cases, but also the local data at our rate being at 15 being more than double the minimum for the purple tier. We are still in consultation with the state about Victory Christian's application, as well as about whether the state may be revising any of the rules regarding the waiver application. So it may take a little bit longer to go through this process than usual.
Thank you, Adam. I really appreciate that. So let's head over to our media folks, and Mary Callahan, you're up. You'll just have to unmute yourself.
Hi, thank you. Hi, Jennifer.
Hi.
I had a couple of questions. One involved the spike that we had over the weekend. Do we know anything about the source of that, the 2 days where we had a rather high number?
Dr. Mase, would you like to take that one, the spike that occurred over the weekend?
Yeah, maybe I will have Kate answer that. You may have more up-to-date information about that.
Hi, yeah, we are beginning to see an upward trend in our case rates. We track our rates daily locally as well. Today, looking using the 7-day lag, we have a rate of 15.1 cases per 100,000. There's a lot of reasons we might be seeing that spike. It is about 2 weeks after Halloween. We are starting to see cases related to those gatherings. It takes a little while for those cases to trickle in and undergo case investigation so that we have a full count. Right now, there's about 25 cases with some association with Halloween, whether they're a case or a contact that are working with public health. And we also know that there's widespread transmission in counties surrounding us, as well as Sonoma County, that may also be contributing to the rise that we're seeing locally as people may be crossing our borders from other counties that are beginning to experience more transmission.
Thank you.
Yeah.
Also, let's see here. Do you have any information on the most recent fatality? I can actually maybe be able to get that from Paul Gullickson, but I'm wondering if you anticipate the possibility. I know LA County has talked about maybe having to impose some sort of a curfew if the latest round of restrictions doesn't have sufficient impact. And I'm also wondering if you know whether the recent surge has increased testing enough to have an impact on turnaround times for results and difficulty scheduling.
Yeah, I don't think that the increase has really affected turnaround time. Our lab is still reporting a turnaround time of 24 to 48 hours. And we haven't heard of any increase in turnaround time through OptumServe either.
Thank you.
As far as the curfew, I think that's being discussed actually at a state level, and there have been some talks about that. So we're waiting to see what the governor and the state health officer determine for that. And as far as any specific cases, we're not discussing any specific details, but I think you can follow up with Paul if you need to get some more specific data on that.
Okay, great. Thank you so much.
Thank you, Mary. Appreciate it. Okay, and on to Bill Swindell. Please go ahead.
Can you hear me, Dr. Mase?
We can hear you.
Okay, great. My question is on establishments, businesses, restaurants, wineries that we're going into the winter season. They're putting up tents, heat lamps to get folks to come in there. Are there any restrictions specifically with tents in terms of what they can do and can't in terms of not spreading COVID through the county health department? Within there, I know that some have had like 3 sides, but have one side open. Is there any directives or any things in terms of those that are tenting their facilities that they can or cannot do when it comes to COVID?
Yeah, that's a really good question. I'm going to have Adam from County Counsel's office respond to that.
The rule as it stands right now for outdoor operations of any business operating outdoors is that outdoor operations may be conducted under a tent, canopy, or other sun shelter as long as no more than one side is closed to allow for sufficient outdoor air movement, and that other permitting and licensing restrictions may still apply. I know that the state is working on revising, and that language comes from many of the state guidance, but I know that the state is working on revising that language to provide maybe some more practical details, and we're looking forward to that guidance coming out hopefully soon, as well as trying to work with our city partners in other jurisdictions to try to figure out ways that we can implement the intent of the state language at least as it currently stands.
Okay. Have you had businesses come to you that are, said that we are doing a tent, but they've done it in past years, but are worried that they could be in violation of this?
Yes, businesses have reached out, as well as business organizations have reached out to ask whether their particular setup may be acceptable under the current language of the FAQ and state guidance.
Okay. And that's going to be the call then coming from the state, and you envision within soon then that we may get some more clarity on this?
Last time I checked with the state, they said soon, and we're hoping for, with the change in the weather, that we're hoping that it will be issued soon, but we can't say for sure, since we haven't seen anything, and yes.
Okay, thanks.
Thank you, Bill. Okay, appreciate those questions. So I wanted to acknowledge a question from Jill on social media, who asked, do schools need any input or approvals from Sonoma County to implement the public health cohorting guidance from August, which was updated early September, regarding targeted and specialized support services? Adam, is that something that you might have information on? If not, we can follow up later on social media.
Yeah, let me quickly pull that up. The state guidance itself indicates that as long as the guidance is followed, they do not have to obtain a approval like they would if they wanted to reopen the school under the waiver process. So as long as they comply with the requirements as spelled out by the state, they don't have to submit something akin to like a waiver for the health officer to review and approve.
Got it. Thank you. And Nick from social media is asking, how many of our cases have pre-existing conditions? How old are patients? And information on additional illnesses And I wanted to let everyone know that we actually have a data dashboard set up that's publicly available. And it is just a treasure trove of transparent numbers. So if you go to socoemergency.org, there's a link there to the coronavirus dashboard. And I mean, book out a couple hours for yourselves and have a look through that data. It is very substantial and in-depth, and we update it every day. So I would recommend that Nick check that out. And then we'll pop over to Ted Williams. You'll just have to unmute yourself, Ted.
Hey, good afternoon. Thank you, Jennifer. Thank you, Dr. Mase. Are you familiar with the new Google Maps overlay program that just went online that gives people saturations of COVID and space places, safe routes for places and stores to shop in based on data? Are you familiar with that?
Dr. Mase, is that something your team is looking at?
Jennifer, no, I'm not familiar with it, but.
Yeah, it's brand new, and I thought it might be helpful, and it might be something to look at too. And I wondered if well, you would know, obviously, if it was coming from you that you were contributing the data to that. Just wanted to find out if that was something. And then some of my listeners were also asking about an application, and an iPhone app that's now becoming available for public health notification. Is that something that's coming from the county as well?
Notification of cases, or what is that for? What's the purpose of the app?
The app, I guess the application is that it'll continue to give people updates if there's any alerts, alarms, if there's someone near you that's been proven positive, the people that are contributing to it and following it will be a source of pinpoint for an area around that person that other people can then get notified that that person is nearby or their potential exposure for the infection.
Yeah, I think I may have read something about this new app. Of course, we also have our SoCo COVID Check app. That's different. That's for screening of symptoms every day and ensuring that there's no need necessarily to get tested and for employee screening. But I don't know if Adam or Kate or even Jennifer, if you know anything more about this new app. I think I read something about it.
Are you asking about California COVID Notify? I think it's part of the UC program.
I'm not sure what the roots of it are, but I did see this and other people have been asking about it. So I thought I might just pass it by you to see if something this has come across your radar at all. I think there's a lot of stuff coming by all the time, and some are legitimate and some aren't, and so the more these things get kind of fleshed out, the better. But I'll leave it with that and let other people ask. Thanks.
Thank you, Ted. Appreciate it. And sounds like you've shared two good resources here, and I really appreciate that for our awareness and our community. Okay, we will look to Will Schmidt. Will, you'll just have to unmute.
Hi, Jennifer. How you doing?
Good to be here.
Hey, Dr. Mase, just wanted to follow up on the questions I asked on Monday about the upcoming holiday season. Just kind of, you had outlined some ways to be safe if you're going to gather during the pandemic. Just wanted to kind of double back on that. Are you anticipating a rush in testing as people try to obtain negative test results before they gather, if they gather? And do you see any changes in turnaround times for testing? And then also, if you could speak to the efficacy of securing a negative test result prior to Thanksgiving, whether that makes a difference or whether it just gives you peace of mind or a false peace of mind, just along those lines would be helpful.
Yeah, I don't think that we're seeing any change in turnaround time at this point, where our lab is still at 24 to 48 hours. And I haven't heard of any delays with OptumServe. I think there will be a rush to get tested because people want to know what their test status is. But I do want to caution people that that's just a test at the exact time that you take it. So you could be negative, let's say next Tuesday, yet be positive on Thursday. So it doesn't really protect you to the extent that you might think it does. So it's still best not to gather with extended family and friends and people that you're not normally in the same household with, especially if there's older people, the grandparents, others that are coming, or anybody else who's vulnerable. It's really better not to gather at all this holiday season. Again, a test negative today doesn't guarantee a test negative even a few hours from now.
Thank you. I appreciate that and understand that. Just wanted to go back one more time. So I understand that there's, not been any change in turnaround times observed so far, but are you, if you're anticipating a rush, are you also anticipating a change in turnaround times?
Not for our lab, because we are not providing testing for everybody in the community. Now, OptumServe, it depends. They have a great, I don't even know if we're fully booking all the appointments. I think we're pretty close with the Windsor location and the Santa Rosa location. As of November 30th, I believe another lane will be open in the Santa Rosa location. That's not going to help us for Thanksgiving, but there's a new Petaluma fixed OptumServe site that's coming. So with all this increase in testing, let's hope that the state lab is able to meet the same kind of turnaround times that our county public health lab is able to provide.
Okay, thanks, folks.
Thank you. We'll appreciate your questions. And Julie, you're up.
Hi, thanks so much. Dr. Mase, I was looking at the dashboard today and saw that the percentage of people in the Latino community, or I'm sorry, the percentage of cases is still high for Latinx residents. It's 72%. And I, look at this number fairly often and feels like it's just been stuck there. And I know the county's been doing a lot with outreach and education and targeted testing and alternative housing. So I'm wondering why you think that number's not budging and what you want to see happen.
Well, I think that number from when we first noted that there was a huge disparity in the Latinx has come down a good 20% with all the efforts that we put in. And it is sort of stuck in the 70s, maybe even low 70s at this time, because we're still doing a lot of testing in the Latinx. So we're actually still in that new sort of case finding time. We just started the enhanced pop-up testing a month ago, and the test percentage positivity has been quite high, somewhere around 8 to 10% in the neighborhoods, in the lowest SES census tracts. So I think we're finding a lot of cases among Latinx. So over time, as we continue this testing strategy and the outreach and the financial packages and the working with the business communities, all of our strategies for communication, that disparity should start to close again.
And quick follow-up question, do you know what percentage of our contact tracers speak Spanish? And also someone I know who tested positive for COVID was contacted by someone in San Diego for contact tracing. And I'm wondering if that sounded new to me, but I'm not sure how it works.
Mm-hmm. Well, it's possible that our contact tracers, they're not sitting in one location. They're working from home generally. So we may have contact tracers that are not located in the county. It's all remote. And as far as the percentage bilingual, I'm not certain, and I think maybe Jennifer, you can find out the majority. I think it's well over 2/3 are bilingual, but I don't know. Kate, if you know any more on the percentage of bilingual?
I don't have that percentage right off the top of my head, but I know there has been a concerted effort to hire bilingual and bicultural staff to help with contact tracing as well as the pop-up testing efforts.
Yes, maybe Jennifer, you can find that percentage from Darcy and pass it on.
I'm happy to do that, Julie. I'll follow up with you offline.
Okay, and then very quickly, Kate, or Dr. Mase, do you guys have data over time that shows how that percentage for the Latinx community has changed?
Yeah, absolutely. I think, Kate, you can probably provide that through Jennifer.
Yes, I actually have an email drafted to you, Julie. I'll be sending that to you later today.
Oh, great. Thank you so much.
Wonderful. And then I'd like to hand over to Megan Goldsby for some questions. And fun fact for Facebook viewers, Megan Goldsby's family and my husband's family are actually very close and typically have Thanksgiving together. And this year we are not doing that. There's no Thanksgiving gatherings in the interest of keeping everyone safe and healthy. So just a great example of, the small steps we're all taking to keep Sonoma County safe. Megan, you want to ask a question?
Yeah. Hi there, Jennifer.
Hi.
You're so right about that. That is a good fun fact to add. Thank you all for taking my question. I wanted to make sure I understood something that was said at the beginning about the purple and red tier. I know the emergency brake was pulled this week, so there wasn't movement. Were we headed to red this week had that not happened, or are our numbers still set for purple? Thank you.
Yeah, so let me make sure I get this right. We did meet from our calculations, the red metrics for the week starting October 25th, because there's a 7-day lag and it's a 7-day average. But at this time we submitted our adjudication based on that. We haven't heard conclusively from the state as to whether they'll grant us the 1 week in the red tier yet. But given the way the cases are going, as I'd said earlier, I think it's probably unlikely they're going to approve an adjudication request. And even if they did, I don't think we still now meet the metrics to be in red. And you'd have to be in the red for 2 weeks before you can actually change your activities to do the things that are allowed in the red tier.
Right. Okay, I understand. Thank you for clearing that up.
Thank you. And I think we have time for just one more question from Mary. If you've got a quick one, please go ahead.
That was one of them. And the other question was just, are there other things that you're anticipating coming down the pike in terms of, our problems, challenges coming up that we're not imagining or to ask about?
Well, this time I think we're just in that sort of watch and wait phase to see what direction the cases are going to go, whether we are, a couple of weeks behind the rest of the Bay Area and we'll be seeing even greater increases. Right now, we are at the state average of 15 new cases per day per 100,000. So we just have to wait and see what direction that goes. At this time, I think we're not seeing the big increase in hospitalizations and ICU bed use and that kind of thing relating specifically to COVID. So we're not there, and we're just cautiously waiting to see what direction things go and how the holidays have impacted.
Yeah. Thank you so much.
Thank you, Dr. Mason. I was wondering if you could just send us off with a note. We had a question from Facebook regarding, how people use shared spaces and the importance of maintaining social distance and wearing masks. Could you just say, a couple words about that before we sign off?
Shared spaces for
courtyards, walkways.
Oh, I see. Like that. Yeah, so I think the key there is if you are not able to socially or physically distance, even if you're outdoors, that it'd be really important to ensure that you're carrying your facial covering or mask and that you can use that. It seems that these kinds of barriers are really effective, not just as CDC just put out, not just to protect others around you, but actually to protect yourself from COVID as well. That's the latest that we've heard from CDC. So by all means, if you are going to be in any circumstances where you feel like you're not 6 feet away from others that are not household members, wear your mask, follow the general hygiene practices, wipe down shared surfaces, and just be safe.
Thank you very much. And I think that wraps us up for today. Thank you all for watching, and we'll see you back next week.